Here's what most people believe about healthcare collapse. It happens somewhere else, in underdeveloped countries, in places without proper infrastructure. You'll see it on the news, hospitals overwhelmed, medicine running out, people waiting in corridors for beds that don't exist. And you'll know when it arrives because it will be impossible to miss. It's a compelling story, and it is almost completely wrong. Because when you actually study how healthcare systems fail, the real ones, not the version reconstructed in hindsight, every major collapse in modern history was preceded by months, sometimes years, of visible, readable, accessible warning signals. Not in medical journals, not in government health reports locked behind paywalls, in pharmacy lines, in prescription bottles, in appointment wait times, in the generic drug aisle of your local drugstore. The signals were there. Most people walked right past them, not because they were foolish, because they didn't know what they were looking at. That's the only thing separating the people who protected themselves from the people who got caught completely off guard. In East Germany, 1988, common medications began disappearing from pharmacy shelves. Patients were told it was a temporary supply adjustment. 18 months later, the government couldn't afford to import them anymore, and then ceased to exist entirely. In Greece, 2010, hospital supply budgets were quietly cut by 30% before a single headline announced austerity. Nurses began rationing gauze. Surgeries were postponed, not because of scheduling, because there weren't enough surgical gloves. In Venezuela, beginning in 2009, pharmacies started substituting brand medications with generics, then substituting generics with nothing. 6 years before the full collapse, the signal was already running on the shelves of ordinary drugstores in Caracas. None of these warnings were secret. None required special access. They were visible to anyone who knew what they were looking for. That's what this video is. 5 signals, each documented across multiple healthcare crises, each observable right now in 2026, with nothing more than your phone, your eyes, and 20 minutes a week. By the end of this video, you're going to walk into a pharmacy differently, read a medical bill differently, interpret a doctor's appointment wait time differently, because the information was always there. One principle before the first signal, short, and it matters more than anything else we'll cover today. Healthcare systems don't collapse suddenly. They erode suddenly, to the people not paying attention. By the time a hospital closure makes the local news, it has been financially insolvent for 18 months. By the time a drug shortage hits mainstream headlines, the supply chain has been contracting for a year. The front page is not breaking news. It's the moment the system stopped being able to hide what was already happening. The people who navigated Greece's 2010 health crisis with their well-being intact weren't wealthier or better connected. They were reading their environment while everyone around them was waiting for an official announcement. Official announcements describe what has already happened. Your pharmacy is a leading indicator. So is your insurance card, your appointment calendar, and your hospital's parking lot. The skill we're building today is the ability to read that broadcast before the headlines catch up. Let's go. Signal 1, the prescription that changed without telling you. Open your medicine cabinet. Pick up any prescription you've been on for more than a year. Look at the label. Now try to remember, is the manufacturer the same as 6 months ago? Most people can't answer that question. That's exactly the problem. When a pharmacy switches your medication from one generic manufacturer to another, they are legally required to tell you almost nothing as long as the active ingredient and dosage remain the same. The bottle looks the same. The pill may look different. Most patients never notice. The crisis signal isn't one switch, it's repeated switches across multiple drug categories in a short window. When your pharmacy switches the manufacturer on your blood pressure medication, your thyroid medication, and your cholesterol medication within the same 90-day period, that pharmacy's supply relationships are under active stress. Their primary suppliers can't fulfill orders consistently. They're sourcing from whoever has inventory at higher cost and lower reliability. That pattern means the upstream supply chain, which for American medications runs primarily through manufacturing facilities in India and China, is experiencing disruption significant enough to break established distribution contracts. In Cyprus, 2012, pharmacists began quietly rotating between 4 and 5 different generic manufacturers for the same medications within single months. Each individual switch was explainable. The aggregate pattern was a supply chain under severe financial stress. The banking crisis that froze the country's accounts 3 months later had already been moving through the pharmaceutical supply chain. Every time you pick up a prescription, photograph the manufacturer name on the label, not the drug name, the manufacturer. Build a 3-month record. 1 switch is routine. 2 switches on the same medication within 90 days is a yellow flag. 3 is a signal worth taking seriously. Signal 2, the waiting room that keeps getting bigger. You already know that getting a doctor's appointment takes longer than it used to. Most people file this under "the system is overwhelmed" and stop thinking about it. Here's the distinction that changes that calculation entirely. A long wait is a capacity problem. An accelerating wait is a collapse signal. In a strained but stable system, appointment lead times are long but consistent. 6 weeks in January, 6 weeks in March. The system is holding. When the lead time itself is growing, 6 weeks in January, 8 weeks in March, 11 weeks in May, the system is not holding. It is contracting. Physicians are leaving faster than they're being replaced. Practices are closing. The patient load is being distributed across a shrinking provider base. The second tier of this signal that almost nobody checks, the type of appointment getting longer. Routine preventive care extending is a capacity signal. When urgent care appointments begin extending beyond 48 hours, that's a different signal entirely. That's a system that can no longer triage effectively. In the United Kingdom's NHS, beginning in 2017, the extension of urgent referral wait times preceded every subsequent headline about system crisis by an average of 7 months. The journalists were writing about what the appointment data had already been showing for nearly a year. Call your primary care physician today. Ask for the next available routine appointment. Write down the number. Repeat every 90 days. You're not tracking the number, you're tracking the rate of change. A number that keeps growing is a system that keeps shrinking.
Signal 3, the generic aisle that's disappearing. Walk to the over-the-counter medication section of any pharmacy. Find the store brand generic section, the row of white label bottles next to the name brands. Now look at which ones are missing. Under normal conditions, store brand generics maintain higher inventory than name brands. They're cheaper to stock, faster to move, and have higher margin. If anything, the generic shelf should be fuller than the brand shelf. When generics are consistently out of stock while name brands remain available, the supply economics have inverted. The specific category to watch most closely: antibiotics, pain management, and fever reducers. These 3 categories represent the base layer of acute care management. When these generics become consistently unavailable, you're not looking at a supply inconvenience, you're looking at a healthcare system's capacity to manage common illness starting to degrade at the consumer level before it reaches the clinical level. In Venezuela, beginning in 2013, the first category to disappear from pharmacy shelves wasn't specialty medication, it was ibuprofen, then basic antibiotics, then insulin. The collapse didn't start with the dramatic drugs, it started with the ones so ordinary that their absence seemed impossible to take seriously. A pharmacist in Caracas described it this way: customers would come in, ask for amoxicillin, be told it was unavailable, and leave assuming it was a one-store problem. None of them connected the dots that every pharmacy on the same street was having the same conversation. Visit the same pharmacy every 2 weeks. Photograph the generic antibiotic and pain relief sections, not the prices, the inventory depth. A consistent pattern of facing, products pulled to the front to conceal empty space behind, is the pharmacy version of the grocery store signal. The shelf is lying to your face. Reach behind the front row. Signal 4, the insurance letter written to confuse you. Insurance companies have a precisely engineered communication strategy. Everything that benefits you gets communicated clearly, proactively, in large font. Everything that harms you arrives buried in the middle of a 6-page letter titled Important Updates to Your Plan Benefits, in the third paragraph, in the same font size as the footnotes. This is not accidental, it is designed. 2 things to watch for specifically. Formulary changes. When a drug moves from Tier 2 to Tier 3, your out-of-pocket cost may triple overnight. And prior authorization expansion. When a treatment that previously required no pre-approval suddenly requires it, your insurer has made an actuarial decision that the cost of that treatment is exceeding their projections. They are installing a friction mechanism. One expansion is routine. Multiple expansions across different treatment categories within a single plan year is an insurer managing a cost crisis in real time. In Greece, 2011, the state insurance fund began delaying physician reimbursements by 90, then 180 days. Doctors knew, patients didn't. By the time patients learned, when their doctors
If you liked this video, don't forget the like, share and subscribe.